Good day, everyone. I'm Dr. RJ Nagit, and for this session, Lecture 10, we will talk about outbreaks and epidemics. So these will be the learning objectives of our session. For the health allied professionals, we aim to reinforce learner understanding on key considerations in identifying, anticipating, and declaring outbreaks. We also aim to contextualize the COVID-19 pandemic in terms of existing frameworks of understanding these outbreaks. For the non-health professionals, our teachers and our support staff, we aim to introduce them and demystify key considerations in what constitutes an outbreak and an epidemic, as well as clarify key concepts of epidemiology critical to the understanding of disease. In the Philippines, we have what we call the triple burden of disease. So we have communicable, or what they call infectious diseases. We have non-communicable, or what they popularly term as lifestyle-related diseases, as well as diseases of rapid urbanization. So when we talk about diseases of rapid urbanization, this is where mental health concerns as well as substance use problems are actually classified. So when a certain disease quickly spreads, that's what we call an outbreak. So it's a quick spread of a certain disease, whether communicable or non-communicable. And when we're talking about the spread of a disease, we have to understand its spread. Is it only confined to a specific area, or is it occurring in multiple sites? Is the rate of increase high, or are we noticing spikes, or are we just noticing very sporadic occurrences of disease? So when we describe the patterns of occurrence, we have terms such as endemic, epidemic, pandemic, and what I mentioned earlier already, sporadic occurrence of disease. So usually when we talk about sporadic diseases, these are solitary and they do not actually spread continuously in a certain area. But when we talk about endemic diseases, these are actually described as frequent and continuously spreading in a certain geographical site. So for example, in our country, there are certain areas that malaria, tuberculosis, and HIV are actually endemic because they continuously spread. And if you would look at the graph, if we would plot the number of cases in the graph, they're actually forming a straight line. Another pattern of occurrence is what we call epidemics. So these are actually described as unexpected increases in the occurrence of a disease in a specific geographical area. So on your right, you can see a graph. So for example, if we plot the number of cases of a certain disease in a graph, there is usually an index case where they're the ones who actually get the disease first. And then after several days, you would see a spike in the number of cases. So usually this is a pattern that you would see in infectious disease where they exponentially grow, but they're still confined in a specific geographical area. So again, they can be communicable as well as non-communicable diseases. So on this slide, you can see the difference between endemic and epidemics. So in endemic diseases, they're usually forming a straight line. There's very low level of variability in terms of the number of cases given a specific time period. But when we talk about epidemics, they are actually forming spikes. There's a quick rise in the number of cases in a geographical area. Another pattern of occurrence, which I think we are all familiar with right now, is what we call epidemic. So an example of which is the COVID-19 pandemic, where we saw an increase in the number of cases in multiple countries. So there's actually a global or an exponential increase in the number of cases in a specific time frame. Another concept that we need to understand about outbreaks is the concept of incidence versus prevalence, and how do they actually differ. So when we talk about incidence, these are the number of new cases of a specific disease in a short period of time for a specific population. But when we talk about prevalence, these are the number of people who actually contracted the disease or gotten infected with a certain infectious agent. So on your right, you can see a diagram that would actually help us understand better the concept of incidence versus prevalence. So say, for example, you are in a tub filled with water. The drops coming from the faucet are actually the incidence or the new number of cases. So the number of new cases which gets added to the total number of cases, that's what you call incidence. But once they get added to the water in the tub, that's what you call prevalence. So that's actually one of the things that would help you understand the difference between incidence. So again, when we talk about incidence, it's the number of new cases, and prevalence, it's talking about the total number of people who have contracted the disease. The next concept that I'd like to introduce to you is what we call the epidemiologic triangle. So for any disease process to occur or be prevented, there's actually a relationship between the host, the agent, and the environment. So if we actually modify these, for example, if we modify the host, the susceptibility of the host, or the increase in terms of the infectiousness of an agent, that would actually affect the spread of disease. So we will go through them one by one. So when we talk about the host, this is actually the individual that is infected or that develop a certain disease. So as individuals, there are a lot of factors that are at play. So that includes our physical health, our immune status, our nutrition status, the kind of exposures that we have. So the stressors can actually decrease the level of immunity of certain individuals, especially if they've been stressed for a very long time. So that can facilitate the development of the disease process. And of course, there are certain medical conditions such as HIV or certain autoimmune disorders or certain medications that can suppress the immune system of a person. So that can actually also predispose the person developing a certain disease. Another factor about the host that we need to look into is the host behavior, or how the host interacts with the environment, or the possible reservoir of the infectious agent. So for example, if we're going to talk about the sexually transmitted infections, so if we do not use the right protection, that would actually facilitate the development of STIs later on. Of course, social determinants of health are also very important factors to look into. So they can affect directly or indirectly the disease process. So for example, when we talk about education, for example, if the people are more aware in terms of how a disease process is occurring, or how the infectious agent is transferred to the susceptible host, then probably they would take more steps in terms of how to protect themselves. So it's very important to look into the level of education, the income status, which would allow them access to food and of course basic health services, as well as housing, because that can actually also impact the exposure of individuals to certain microorganisms or certain disorders. Another element in the epidemiological triangle that we need to look into is the agent or the infectious agent. So it can be a virus, it can be a bacteria, a parasite, or a fungi. So all of them can actually cause certain diseases that you can see on your right. So it's very important to look into the characteristics of the infectious agent, because that would probably give us a picture in terms of how fast or how slow the disease process will develop and infect other people, or how severe or less severe the manifestations of a certain disease. It's also important for us to understand the mode of transmission, because usually, especially in airborne as well as respiratory and other respiratory diseases, the transmission is higher as compared to those who are transmitted by a sexual contact or mother-to-child transmission, which is usually the case for certain bloodborne disorders. The last element that we need to look into in the epidemiological triangle is the environment. So this is where the importance of safe and clean environments actually play a big role. Of course, access to water is important. Of course, if we have contaminated water that can actually lead to infectious diarrhea, or if it's contaminated by certain metals that can actually also lead to a certain disease in human beings. Access to water is also very important because that can actually provide us with avenues in terms of how we can protect ourselves. So for example, hand washing is is one of the key components in terms of protecting ourselves. So that can only be done if there is adequate access to water. In areas where there's a high prevalence of airborne diseases or respiratory related diseases, ventilation is actually key. So if we have good ventilation in a specific area, that would lessen the chance of the viral particles being inhaled and causing disease later on. Another concept that we need to look into in terms of the environment is population density. So when we talk about population density, this talks about the number of people in a specific area. So the more people are in a certain geographical area, the higher the chance that more people will be infected with an infectious disease. And lastly, climate and weather. Of course, there are a lot of literature right now looking at the association with climate change and the changing disease patterns of certain infectious agents. That's why it's very important to consider also the climate and weather. So aside from communicable diseases, as I've mentioned earlier, we also have non-communicable diseases. And compared to infectious diseases that spread very rapidly, NCDs are actually usually occur and develop for a very long time. So they spread differently. They might spread in terms of contaminating natural sources. They might be a result of sedentary lifestyles, risky behaviors, various psychosocial stressors for mental health concerns, as well as social factors. Usually, NCDs are chronic in nature, meaning they are long-term and they do not resolve spontaneously as compared to infectious diseases, as compared to most of the infectious diseases. And of course, complete cure is rarely achieved. Another thing that we need to understand about pandemics is that there's actually a social impact that we also need to be mindful of. And especially if we work with communities, schools, workplaces, in our barangays, there's actually a differentiated risk in terms of the individual as well as at the community level. And there's also a differentiated impact because, of course, on your right, you can see a picture that shows you a rough sea, and there are different sizes of boats. And they would always say that we might be in the same storm, but the boats that we're in are actually different. So our ability to weather the pandemic out is actually dependent in terms of the resources that we also have. And of course, given the state of the pandemic right now, it actually widened certain long-standing inequities already. So there's disruption in terms of the non-COVID health services. So we might see a rise later on of non-communicable diseases that are left unaddressed right now. Because of the stressors that we face, there might be an epidemic of mental health problems in our country. That's why those are the things that we need to be mindful of. And of course, inequities are also very apparent in terms of economic and social support. That's why our ability to weather the pandemic should also be complemented with initiatives coming from the government so that we can actually mitigate the social and even economic impacts of the pandemic. So that's it for our lecture 10. And hopefully the lessons that you have learned in this session would actually be helpful for you to develop ways in terms of how to address both communicable and non-communicable diseases in your school setting. Thank you very much.